Hello, and thank you for joining me. My name is Melissa Sweet, and I'm a public health journalist and editor of croaky.org. This is a recording of a presentation that was prepared for delivery to the Congress of Aboriginal and Torres Strait Islander Nurses and Midwives Conference on the Gold Coast on the 12th of October 2017. I would like to begin by paying my respects to the traditional owners of this country, the Yugambeh people, and to elders past and present, and to future generations. This photo is one of the views from my kitchen table. This photo is also the view from my kitchen table. I live and work on a rural property about halfway between Canberra and Sydney, in an area crossing the country of Gundungurra and Yuin people, and also spend a fair bit of time working on the country of the Ngunnawal and Ngambri people in Canberra. I often think of an article written by Professor Bronwyn Fredericks and colleagues that says, "We are always guests in country that is not our own." It has been a real honour to be a guest both at your conference, Katzenam, and on this country. I'd like to pay my respects to all of you for the work that you do in your organisations, communities and families. It has been wonderful hearing some of your work at this conference and also meeting some of you both on Twitter and in real life. I'm going to talk a bit about my PhD research as a non-Indigenous public health journalist exploring the history of medical incarceration of Aboriginal and Torres Strait Islander people. I am deeply grateful to Janine Mohammed and Katzenam for engaging with my PhD journey. I also want to acknowledge Janine's invitation for me and for one of my supervisors at the University of Canberra to participate in a Katzenam cultural safety workshop. Janine also participated in a PhD yarning circle at the University of Canberra and in a roundtable meeting in Melbourne earlier this year that considered PhD-related recommendations. I would also like to acknowledge some of the Katzenam conference participants, including Donna Murray, Craig Dukes, Carl Briscoe, and the New South Wales Nurses and Midwives Association for their support of the roundtable meeting, as well as the Australian Psychological Society, the Palm Island Council, and Carnarvon Shire Council. During my PhD journey, other Katzenam members also were generous in sharing their knowledge and expertise, and I particularly thank Professor Juanita Sherwood for reviewing some of the associated work. There is one Katzenam member without whose wisdom and friendship I would not have been able to complete the PhD, and I'd like to send a huge shout out of appreciation and respect to Dr. Lenore Geyer from James Cook University. This is a photo of Lenore with the University of Canberra Vice-Chancellor at my graduation in Parliament House in Canberra a few weeks ago. The tweet was sent by my primary supervisor at the University of Canberra, Associate Professor Kerry McCallum. It seems very appropriate to show this image as a tweet, given that Lenore and I first met on Twitter, and we did quite a bit of work together via Twitter before we even had the chance to meet in real life. It is a reminder, as we've seen at this conference, of the potential for using Twitter as a platform for developing relationships and networks for change. And here is the rest of the PhD team, including colleagues at the University of Canberra, Professor Pat Dudgeon from the University of Western Australia, and I'd particularly like to acknowledge Richard Weston from the Healing Foundation, Kathleen Musulin from Carnarvon, Alwyn Chong from Adelaide, and Renee Williams from Cairns. I also acknowledge Luke Pearson and all who have contributed to the Indigenous X project, another acknowledgement of the power of Twitter collectives in challenging and rewriting mainstream narratives. I also pay my respects to the many Aboriginal and Torres Strait Islander scholars, including members of Katzenam, organisations and community members whose work I drew upon and privileged in researching the history of medical incarceration. Before I go any further, we've been talking about self-care at this conference, and it's important to let you know that I'm going to be talking about some traumatic history. If you don't feel up for this right now, please feel free to take a break. This book is by a Swedish author who travelled Australia unpacking the terra nullius concept, the profoundly ignorant and shameful white supremacist worldview that this was nobody's land. When I bought this book at an airport in 2008, I was stunned to learn that Aboriginal people had been imprisoned at 2 remote island hospitals off the Western Australian coast in the early 1900s. They were said to have venereal diseases, a non-specific diagnosis that at the time was often made by police officers or others without medical qualifications. How could I not have known about these lock hospitals after more than 20 years of reporting on health and medicine? I began to ask around widely, including of health professionals working in Indigenous health. It was unusual to find someone who knew this history. The more I searched, the more I realised that my initial outrage revealed an even more profound ignorance. That if I had had a better grasp of the colonial history of Australia and of healthcare, I would have realised that this history of medical incarceration, while shocking, is not exceptional. Rather, it is emblematic of the historic and ongoing role of healthcare in harmful colonising practices, and thus one part of a much bigger story. My own ignorance reflected a wider state of oblivion in the non-Indigenous community about the historic and ongoing impacts of colonisation. So I bought this book by Sven Lindqvist. I read a few pages about the history of the lock hospitals of Bernier and Dorey Islands off the coast from Carnarvon, and the story grabbed me. Never let it be said that books don't change lives. I ended up doing a PhD as a way to find out more about these island lock hospitals that operated from 1908 to 1918-19. The concept of lock hospitals comes from England in the 1800s, when these medical prisons were used to confine women in English garrison and naval port towns who were thought to be engaged in sex work and to have venereal disease. The lock hospitals were set up under a series of Contagious Diseases Acts designed to protect the health of soldiers rather than the prisoner patients. Following vocal opposition, the legislation was repealed in Britain in the late 1800s, although similar measures continued elsewhere in the British Empire, including in Australia. This photo is from the 1 Mile jetty at Carnarvon. I wonder how many of you have been there. Carnarvon is a focal point for the history of the Western Australian lock hospitals because it was from the famous jetty there, now a tourist spot, that hundreds of men, women and also some children were taken to boats for the often traumatic and perilous journeys to the Bernier and Dorey Islands. At this point in time, everyone who goes to that jetty, the local and visiting school children, the fishermen and the fisherwomen, the tourists, the health professionals, they do not learn anything of that jetty's role in an incredibly traumatic history. Millions of dollars of Western Australia's royalties for the region's money have gone to a tourist centre and historical display at the jetty. And yet, as this sign illustrates in more ways than it intends, we learn only a little bit of history. Doesn't that say something about the way colonial history has been told more widely? However, I am very pleased to report that work is underway to ensure there is some historical truth-telling injected into the displays at the jetty. I've spent many hours walking around that jetty, photographing it from all different angles. This is the photo that speaks most to me. It is taken from near the end of the jetty, looking back to the land. When I stood on that jetty to take that photo, I tried hard to imagine what it must have been like for the people, wrenched from their country and their families, often by police, and brought long distances to Carnarvon, often in chains. In the early years of the Lock Hospital scheme, Western Australia's Chief Protector, Charles Gale, was reported in newspapers acknowledging that collections for the lock hospitals had been difficult because they were seen, he said, as a sort of jail. He said, "I regret to say that at times force has to be used to bring people to the islands." His annual reports recorded high death rates on the islands. Yet at the same time, he could write in these reports that the lock hospitals were humanitarian work and described them as, quotes, "a great undertaking." When I look at this photo, I reflect on the impossibility of ever really knowing what it was like for those people taken to the islands. But I also reflect upon the absolute importance of trying to understand, the absolute importance of remembering those people and ensuring that respect is paid to their memories. The men and women were segregated on the islands. For most of the period, the men were on Bernier and the women on Dorre Island. This photograph gives an idea of the conditions on the islands, which are Mulgana country, sand dunes, low scrub. The winds blow hard there at certain times of the year. Yet we know from newspaper and other accounts that despite the hardship, their fear of the medical instruments and experiments, and their misery at being away from home, we know that the people danced, they fished, hunted, and they practiced culture. And some were overjoyed to finally be released back to their homes. This plaque was erected on Dorey Island some years ago, way out of sight for most people, given the difficulty of visiting the islands, which are World Heritage listed and protected areas. As part of my research, I asked scores of Aboriginal and Torres Strait Islander people, including some nurses and other health professionals, about these histories, about why they mattered and what they wanted out of the PhD project. There is a strong wish by Aboriginal people in Carnarvon and other places that there be memorials to acknowledge this history in other accessible public places, and also for this history to be part of the curriculum in schools and universities. Interviewees wanted the wider Australian community to know what Aboriginal people went through, while another typical comment was, "I want everyone to understand." This is one of my favourite photos. It shows Kathleen Musulin, a Mulgana Yawuru woman who lives in Carnarvon with her 2 daughters and her 2 granddaughters. We are in the beautiful Sacred Heart Church at Beagle Bay. We are on a road trip of a lifetime, travelling from Carnarvon to Broome and Beagle Bay, retracing the footsteps of Kathleen's grandfather, who was taken from his family and put into the mission at Beagle Bay. This is the story that Kathleen was given by her mother. It is that Kathleen's grandfather, as soon as he was old enough to leave Beagle Bay, he made the journey to Carnarvon and Shark Bay, more than 1,500 kilometres, in search of his mother, who had been taken away to the island lock hospitals. He never found her. She is presumed to have perished on the islands, but he remained in the Shark Bay region all his life, which is how Kathleen and her family came to grow up there. Kathleen is now working to ensure there is proper acknowledgement for not only her ancestor, but all those who were taken so cruelly away. Let's be very clear that this was explicitly racist policy. Non-Indigenous people with venereal disease, which was seen as a huge problem for the general population at the time, they were not taken away to island prison hospitals. Quite the reverse. Delegates at an Australasian Medical Congress in Sydney in 1911 recommended increased efforts in prevention and treatment for venereal diseases, stating that general hospitals and dispensaries, rather than public or lock hospitals, should provide the necessary accommodation for venereal cases. In 1921, hospital authorities in New South Wales argued that general hospitals were better than lock hospitals for treating venereal infections because, they said, lock hospitals promoted stigma and discouraged people from seeking treatment. Last year, you may have seen the SBS documentary, Who Do You Think You Are?, featuring the musician and former federal government minister Peter Garrett. He went to visit the islands where his grandmother worked as a nurse, travelling across from Carnarvon with Kathleen Musulin and Bob Dorey, Bob you see there in the photo, as well as a film crew. Bob Dorey is also working with Kathleen and the Carnarvon Shire Council towards a memorial project. Hopefully, there will soon be some acknowledgement of this history at the 1 Mile Jetty and elsewhere in Carnarvon. When Peter Garrett wrote his memoir a few years ago, Big Blue Sky, he mentioned that his grandmother had worked with people with leprosy in Western Australia. This was before his eyes had been opened to the true history. It is a common mistake thinking that the island lock hospitals were for people with leprosy. This may reflect the stigma surrounding sexually transmissible infections, as well as the intertwined history of STIs and leprosy. But it also reflects that these lock hospitals for venereal diseases were part of a wider history of medical incarceration. As this map shows, the punitive surveillance and medical incarceration of Aboriginal and Torres Strait Islander people, whether for STIs or leprosy, went on for about a century in Western Australia, Queensland and the Northern Territory. It was putting this map together that helped me to start understanding this history as representing a system of medical incarceration rather than isolated episodes. People were moved vast distances between these institutions, from across Western Australia to Carnarvon. Then, when the lock hospitals there closed, some were moved to a new lock hospital at Port Hedland. And they were moved from Cossack, Derby, Beagle Bay and Broome to the Channel Island Leprosarium in the Northern Territory. Newspapers reported on the traumatic conditions in which people were shipped in luggers from WA to Darwin. Then, when the Channel Island facility closed in 1955, some people were transported back to Western Australia, years after they had been taken away. People were not only locked up in institutions, they were confined in other ways too. From 1941 to 1963, the so-called leper line was in place in Western Australia, whereby Aboriginal people living to the north of this line had to apply for a permit to travel south for medical treatment or other reasons. This is not ancient history. Chains were still being used to detain people suspected to have leprosy in Western Australia as late as 1949. These histories highlight a long-standing connection between coercive practices in the health, policing and justice systems as important and ongoing health concerns for Aboriginal and Torres Strait Islander people. These episodes were largely portrayed in public and government debate at the time as benevolent humanitarian interventions. However, they inflicted physical, mental, social, emotional, cultural and spiritual trauma for a period lasting almost a century. They led to the dislocation of multiple generations of people from their families, communities and country, and were part of a pattern of events and policies that interrupted people's ability to care for country and to undertake cultural practices and responsibilities. A Yamatji researcher, Dr. Robin Barrington, has investigated the history of a Yamatji lawman, Jarl, who was incarcerated both at Wodjuma, or Rottnest Island, and the Bernier Island Lock Hospital. She provides in her PhD what is believed to be the first such account of an Aboriginal prisoner patient, and his history before and after exile at a lock hospital. Her research demonstrates the devastating impact for women and children left behind who were vulnerable to institutionalisation and coercion by government agents and others. Giles' removal from country had a significant impact on his capacity to participate in family, cultural, social and economic responsibilities throughout his lifetime, and it left his family dispersed and vulnerable. These were the experiences of many other families around the continent, whose ties were fragmented, often forever, by the policies of medical incarceration. It is not surprising that the archives and old newspapers have many reports of people escaping or attempting to escape from these institutions and collections. I thank Mrs. Magdalena Blackley from Palm Island for sharing this image with us. It is a notice about a healing ceremony conducted some years ago on Fantome Island, which is part of the Palm Island group near Townsville. Fantome was the site of both a lock hospital and a lazaret. It was a place for medical incarceration from 1928 until 1973. Many people were very pleased to have this opportunity for a healing ceremony on Fantome Island some years ago, but so much more work like this is needed. This photo is from a visit that we made to Fantome Island a few years ago, and there is Veronica Coutts. She is a local teacher and she takes her students to Fantome Island because it is important for them to know this history, she says. This photo is also a reminder of the need for some serious effort to protect and preserve these sites. Where we are walking there in the photo is believed to be the cemetery for the Fantome Island Lock Hospital, but there is only one grave that is marked. As in many of the other places of medical incarceration, the burial sites are not protected. So we've been taking a rather traumatic history of healthcare. What can help with the healing? First up, purposeful storytelling. One way to heal is through telling stories of acknowledgement, following proper process with respect. Historical truth-telling is a cornerstone of healing. Projects of acknowledgement and healing can also help. A recommendation from my PhD is that health systems and services establish a day of acknowledgement or a similar mechanism to acknowledge their historic and ongoing role in harmful colonising practices. This day of acknowledgement could be a platform for awareness and uptake of decolonising practice and processes within the health system at local and national levels, and for promoting and embedding cultural safety in policy, practice and systems. Preservation of sites and related archives is also important, and further research with affected communities is also recommended. Another recommendation is that health systems, services and professionals follow the lead of the Australian Psychological Society in making an apology for their roles in such histories. It is noteworthy that the Western Australian, Queensland, Northern Territory and Commonwealth governments were involved in these histories of medical incarceration, as were public health, medical, nursing and other health professionals, bureaucrats and policymakers, medical and public health researchers, non-government organisations and policing and justice systems. Discriminatory social policies were also involved, for example, in relation to pension payments. I would like to end by reading a quote from Dr. Robin Barrington. She says, "Growing up, I was faced with an impenetrable and resolute silence when asking questions about our Yamatji family history. A journey through the colonial archive and listening to contemporary Yamatji oral histories was my awakening to the true extent of the human rights abuses against my Yamatji family and ancestors. Childhood frustrations have transformed into a deep and affectionate respect for the resilience and strengths of my ancestors who endured the most unimaginable atrocities during their lifetimes. I believe that in a spirit of healing through history, we all have a responsibility to tell the many untold stories of injustice and abuse against Aboriginal peoples across Australia that continue to ramify into the present. Thank you all for listening to this story. In coming months, a number of related resources will be released, and of course I will be tweeting them out. Please don't hesitate to be in touch if you have ideas for croaky stories or would like to talk to us about our coverage. And thank you to all Katzenham Conference participants for your fantastic participation in tweeting out the Katzenham 17 news. Thank you.